Let's get on and talk about some other medical problems. I was thinking about heart failure. Does that make people feel tired early or later on in the disease?
Both, but it's kind of a progression. But fatigue is part and parcel of heart failure for sure. The heart failure is when the heart is just simply not pumping blood effectively around, and your body needs blood, and that'll lead to fatigue quickly.
So when somebody's have heart failure, is just because they've got high blood pressure or they've got some congenital problem? How do you figure out if it's heart failure?
Well, we usually do an echocardiogram, but that's after we've done the history and physical, and you can listen to the heart and figure out plenty of things about it. But the echo test tells whether the heart's pumping well, whether there's parts of it that aren't pumping well, whether there's valve leakage that could be leading to heart failure.
So wow, an echocardiogram really gives you, the internal medicine specialist, a huge amount of information how the heart's doing. If you think somebody's in early heart failure and their heart's not pumping good, how do you guide them along?
Okay, so it depends on whether they have poor pump function or poor what's called relaxation of the heart, and those are different things, and we don't want to get too technical, but if they have that poor pump function, you want to make sure, first of all, that they're avoiding salt in their diet and that they are staying physically active, because that's an important part of helping the heart to be sound and to be toned. And then there are certain medicines that we'll use to augment or amplify the heart's pump function.
Are there things that can mimic early heart failure and fatigue? I'm not thinking of anything special, but if somebody thinks my heart's not working good and they're tired all the time, you just have to go through the regular history.
You really do. If people are short of breath, which often happens with heart failure, that of course could be related to the heart, and could be related to a problem with the lungs, and it could be related to something that's distant to both of those things.
So how much activity does it take that person before they get so short of breath? Is it different in everybody? Sometimes I get short of breath if I walk upstairs, but I recover quick.
It is, and of course, with age, you're young, but with age, we all lose some ability, and walking up steps or up hills is much more work than walking on level ground. So that's why people commonly give that, I can't walk up the hill. And that may be an indicator of heart failure, and it may just be an indicator of some age and a little bit of lack of regular activity.
Yeah, and it's, as you say, it's one of the most important things. I was just talking with some square dancers. And square dancers, everybody can do that, and it's good physical exercise, it's good mental, you got to follow the instructions, and it's a happy exercise. People laugh and giggle with each other when they do that.